Try Danny. Hello, Danny. Hello. You'd like to sit there? Hello, Danny.
Okay. Yep, brilliant. To start?
Yes.
Okay. So good afternoon, my name's Danny McLaughlin, I'm one of the anaesthetic registrars. This afternoon I'm going to ask for just over £2,500 investment into delivering brilliant care for patients undergoing surgery. And the rationale behind this is that if we had more of these tablets, then we would need less of these medications. So for the people who don't work in theatres, just to give you a rough idea, we probably do about 100 surgical procedures each day, and a lot of those procedures do need to be done under general anaesthetic, but not all of them, and actually about a third of them could be done with patients awake. So this could be local anaesthetic, spinal injections, or with limb blocks. Everyone looks a bit worried, but these patients are actually pain-free, but they are awake, and that is sometimes preferable for patients. So the reality is, if you're coming to have a hand operation here at Trelisk, someone like me will do an injection up the top of your arm, you have a numb arm, and then you go into theatre and you have an operation like this. No awake patient looking a little bit stressed and worried. And this is very common, and we'll do whole lists of these on a regular basis here. This is a photo of what patients have to look at during the procedure, and if you think if it's like 1 to 2 hours, and then you chuck in a few of these, there's lots of conversations and noises and drilling and alarms. It's actually not that relaxing for patients, so awake doesn't necessarily mean calm and relaxed. And although you have a nice anaesthetist trying to reassure you through this is sometimes not always ideal for patients. So what we often do is we give people sedation. These are IV drugs, anaesthetic drugs, predominantly to make people feel a bit more relaxed, but actually people often are quite sleepy with the sedation medications, and there are risks associated with it, so people can obstruct the airway, they can drop their oxygen levels, people can stop breathing. So sedation are not drugs without risks. People who have sedation have to go to the recovery area after their operation, which is a very busy kind of area part of theatres, spend a bit of time there and then go back to the ward. And actually it kind of slows down the whole process of them coming through theatres. There has been some recent research in the last year showing that actually music, giving patients music to listen to, is as effective as IV sedation drugs in terms of getting people through procedures. And I thought this is a really great idea, really brilliant idea, but we don't really have the facility to offer patients that at present. So what we would need would be additional equipment. So we would need tablet devices that are affordable but functional, wireless headphones, because if you've ever been in theatres, there are so many wires and things that get tangled anyway. Something to protect them just so that they can last as a reasonable time, and disposable headphone covers so that they can be reused between different patients. I'm sure everyone's familiar with the geography of the trust being split over 3 sites, but actually we have 15 operating theatres here at Trelisk, 4 at St Mike's and 2 at West Cornwall, which kind of spreads us out a bit, so you can't really just have one device that gets transported between these areas. So I think realistically we would need 6 devices and 6 headphones to make this work, and that would be focusing them in areas where we do most of our awake surgery. So St Mike's, although there's only 4 theatres, quite a lot of the operations there are patients not having general anaesthetics, and obviously Trelisk being the bulk of our operative work would need a few, but we'd also split between Tower theatres and Trelawney theatres. That is another issue. And in West Cornwall, it would be good to have a device down there. So I think although I think we really deliver great care for these patients at present, I think by this investment, I think we could deliver brilliant care for patients. And this would be by facilitating safer surgery. So by allowing people to have the safest possible operation without needing to have sedation, I think it would make this overall a less stressful and more positive experience for patients, and really being able to offer them something to listen to that they would like is really personalising care, and that's something that we're just not able to offer patients at present. There are additional benefits by these patients can then bypass the recovery. So if you have a procedure without any sedation, you can basically step off of the table and then walk back to SAL or TD, and I think that's really great for kind of turnover. And really these patients will spend less time in hospital providing their day case surgery, and I think that's something that they spend a lot of time waiting around beforehand. I think patients, once they've had their operation, where possible, would like to just get home as soon as possible. I think I've kind of rushed through that very quickly, but I think we're within the time, so I think we'll probably have some questions now.
Thank you very much indeed, Danny. Well done. So I'm going to kick off with one, if I may. Just interested to know if you've seen this operate in other hospitals, other trusts around the country, and what their experience is. Because I'm really sold by what you've described, but I also recognise that as a patient myself, I'm a bit of a coward. And if somebody said to me, "Do you fancy listening to a bit of Elton John, or would you like some sedation?" I'd be going, "Yes, please, for the sedation." You know, just so I wonder how that bit works in terms of patients feeling this is a good choice for them.
Yeah, I think for the first part of your question, I've worked mostly around the southwest. Other centres do have this in place routinely.
Okay.
In the hospitals that I've worked in, we just don't really have the kit. They'll be like, oh, there's one iPad in a hospital and no one's quite sure where it is and things like that. And patients are, I think the default position is a lot of patients think that they're coming to have a general anaesthetic, and it's our job to reassure them that actually having this done is a really safe procedure. And actually we spend about 20 minutes, half an hour with them in the anaesthetic room before they go through to theatre, and part of that's just kind of building up a bit of trust with the patients. We would be there the whole time with them anyway, because we are. I kind of feel like sedation is not a bad option, and for some people I think sedation is the right option, but I feel that there are certainly a group of patients who end up having sedation that I know that they would also have a positive experience without sedation, providing we could just offer them something else. I think if we were to come through as patients, we would think that actually being awake for this is maybe not as nice as we think it is. This is the environment we work in day to day, so we're like, this is all normal for us, but patients are nervous about coming for operations, and they're even more nervous about having them awake. But I think the ones who even are nervous beforehand, if you do an awake operation on them, at the end they think, oh, the majority of the time they'll say, actually that was fine and I don't know why I was nervous, and this is great, I get to have something to eat straight away and I get to go home. So that's my experience is, even when people are nervous, it's a very positive experience for them, but we would still offer them, if people really felt like they needed sedation, then that would still be on the table, but we just don't have the option of this at present.
Okay. Adam, Kim.
Yeah, so Danny, really great idea. I think it's great for quality improvement. So for me, it's great for patient safety. It improves, as you say, their experience, and you'll look at whether they need sedation as well. How are you going to demonstrate the difference? Are you going to do some sort of quality improvement methodology, looking at how that improves your outcomes for your patients, and then where it could be rolled out further?
Yeah, I think the quality improvement part is something that I'm very interested in, but what I've not really done as much of is doing quality improvement that looks at patient experience. And I think this is something that fundamentally, our anaesthetic is our anaesthetic. I think it's a good anaesthetic, but it doesn't necessarily take into account, does the patient feel like they've had a really great operation experience through hospital? I think a simple way of doing it would be to kind of survey patients, whether it's just a little questionnaire that they can fill out. There will be a period of time in hospital before they go home. I think filling it out to say, was this a positive experience for you? Would you consider having it done again without sedation, or would you prefer sedation or general anaesthetic next time? And I think by collecting that data, and I think there's enough people come through that we would get reasonable numbers, and also giving people an opportunity to say, is there anything else that wasn't available to you that you would have preferred? And then we could think about adjusting what's on the devices for patients. But I think keeping that simple, it's just about giving people something to listen to, whether it's radio or a podcast or listen to some music, something simple, just so they're not listening to everything else that's going on around them.
Yeah, thank you.
Anything from you, Adam?
I think it's great. I just wondered whether you thought about virtual reality.
So I was chatting with one of my consultants this morning, and he said that he had been to a meeting where they had these, they basically just had goggles and things that kind of patients would just lie down. And I think that, to me, that just sounds like the ideal. It would be amazing for that, but even to try and put a pitch together to get some quite basic devices is actually, the costs kind of build up pretty quickly. My other worry would be if you get stuff that's really good quality, there's a danger that these things don't mean go astray, but I think if you have something that's quite basic, then actually it's less likely, it's less a target for people to think actually it goes missing. Though not to be like a negative thing, but I would worry about how these things are kind of kept secure and just so they don't go missing. I wasn't very clear on that. I think virtual reality would be amazing, and that I wish I could put that pitch to you today, but I think the cost of that would be, that's probably a bit more aspirational, and this is maybe a bit more realistic, I think.
Yeah. Danny, thank you very much indeed. Well done.
Thank you.
Thank you.
Thank you. So, how did it go?
It was good. It was a little bit nerve-wracking at first, just not really knowing what I was going to get into. But I think it was a really cool idea, just a real novel approach to kind of getting people's ideas together and fundraising. And I definitely would recommend other people to do it again. And the dragons, they were actually pretty nice. They weren't as mean as the ones on TV.
Yeah. Did any of them stand out to you?
The dragons, not really. I think they were all. I think they kind of put you at ease, and they just wanted to find out a little bit more about the PISC. I think it's hard in 5 minutes. It's not a huge amount of time. So although you've got a really good idea of what you're presenting, I think for them there might be things that they just want to ask a few more questions about.
Okay, well, fingers crossed. Good luck.
All right, thanks very much. Cheers.